Okay, so first of all, thank you for answering the questions. Great. What I'm going to talk about really is that we're usually good at, with trainees especially, it's a binary selection, isn't it? They're either great or they're rubbish. But just a question, show of hands here, how many of those, when you have a trainee that falls into the rubbish or in need of improvement category, how many of those sort of analyse their cognitive style, their learning preference, in order to give them feedback? Excellent. Lots of opportunity then. So we asked you some questions. How you tie a knot, what do you do when you go to a museum, and what do you get for a new toy from Amazon? And we got you to choose this thing, and it was basically to do with learning styles. These came up in the 1970s. They thought, when they looked, they realized that people learn in different ways, and so they came up with a variety of classifications, but one of the most common, the first reference there was that you were either visual or you were kinetic, psychomotor, or you were about shapes. And that's so for those of you who, in terms of tying a knot, a textual person will remember to tie a knot because it's left over right over left. Who does it that? Yeah, there's a few. Shape kind of people, and that's me, will just, you know what a knot looks like, but you can't always remember how to tie it or even what it's called. How many of those? Yeah. And then there's the kinetic people who just tie knots. They don't know how. The most extreme example, just for a laugh, I asked a surgeon how to tie a knot, and I gave him a piece of string, and he went, shh, like that. And I said, no, I need you to go through it slowly. And he went, and he couldn't. He literally could not. And he got absolutely furious with himself. And he ran off. 40 minutes later, he came back. He said, I've worked it out. Look. This is how you do it. And, he's a purely psychomotor person, could do it absolutely reliable, but as to why, how, he had no idea. And it took him 40 minutes of hard practice to remember how he tied that knot. So you can classify people into these categories. It's usually through a standard sort of questionnaire. There's about something like 40, 50 questions you answer. You only had 3, so that's not really a big enough sample to be reliable. But you can, and if you know what you're looking for, you can fairly reliably spot these characters in the clinical environment. Now, the question then was, is this educationally useful? And it didn't take very long before, the second reference is a great example, why the notion of learning styles is unhelpful to teachers. And this basically comes down to the idea that if you've got, say you're a primary school teacher or you're a secondary school teacher and you want to teach Shakespeare and you have textual learners, well, that's great. You give a couple of lectures, you give them a book, they will read the book, they'll understand the book, they will like that, that's fantastic. Good. If you have visual shape type learners, well, that's not a problem because you get them to put on a play and you get them to express themselves, and it's all about dynamics and the rest of it. And if you're trying to teach Shakespeare to kinetic learners, you can just get them to see how far they can throw the book. Which is fine, and they'll like that. But then at the end of the day, they've all got to pass an exam, and an exam is a written test. So if you take your kinetic learners and you give them Lego sets and you get them to throw things, that's great. They're still going to fail the exam. And it's the same in medical training. You've still got to pass the college exams. You've still got to pass the medical school exams. So in many ways, the whole idea of learning styles came out of favor. Different styles. So my interest is in cognition, is what's going on under the hood. And I know I've talked about this a lot in the past, so apologies if you heard me say this before, but this is what most people think about cognition, that the green arrow, sensory information comes into your brain, sight, sound, touch, and the rest of it. You think about that, and you've got a big brain, and then you decide what to do. And then the big thing that's off the screen is your memory. And we don't talk about this as a theory of cognition or learning because it's kind of implicit, but it means that the only thing that you can change really is memory. because stuff comes in, you think about it, well, it's all, you've got to know, and this is what you hear all the time. They didn't know, they need to know, I've got to tell them. But it doesn't really work. And if you have, rapidly, I know it's a stupid example, but you look at that, and it looks straightforward. And how many feet does an elephant have? In this case, one too many. And it's a stupid example, but if you look at the top of the screen, well, that's clear, it's an elephant, no doubt about it. You look at the bottom of the screen, 1, 2, 3, 4, 5 feet, that's absolutely fine. You look at the middle and it's, doesn't quite add up. Your eyeballs feel uncomfortable, you can't quite see anything, it just all starts to fade away. So what I've said in the past is that sensory information clearly comes into our minds, and have I got a pointer? And in the middle, the red is our consciousness. But we can't process all that information coming into our mind. We've got to select bits of that information. We've got to process it down to something abstract. So what I'd suggest is that process of abstracting data is that's the basis of our cognitive style. That if we're a textual person, we will want to see words, we will want to hear words, because we like words and that we derive meaning from words very easily. If we're a kind of shape person, we don't like to see the fine detail, we just want to see the big picture. If we're a kinetic person, we want to feel things, we want to do things, and our minds are set up to do that. There's no suggestion this is concrete, all of that is plastic, you can change. And clearly, just because you're a highly kinetic rugby player doesn't mean you're going to fail medical school, it just means you're going to find it hard to sit in lecture theatres and listen all the time. I know I'm a hugely visual person. I hate sitting in lectures. It drives me absolutely up the wall. So if you look at this example, I know it's stupid, is that when you look at it, your eyeballs don't see individual dots. They see a whole picture. And that's why at the top you can see an elephant, that's fine. At the bottom you can see you can see the feet, that's fine. But trying to see both at the same time, our brains really struggle. On the motor side, the same thing happens. This is an example we did a study a few years back of anaesthetists learning how to use a different type of laryngoscope. We didn't ask whether they could succeed at the intubation, because they all did. We looked at whether their intubation was optimal, as in whether they did it quickly, gently, no extraneous movements. And basically, first few times, they were 50% optimal, but it took them 76 attempts to get up to 90%. And it would have taken them several hundred attempts before they were absolutely reliably optimal at intubation. So again, this is about our subconscious processes. If we are learning to do something, our muscles take a lot of repetition, subconscious training. Because this wasn't about understanding. They knew how to intubate, they knew what they had to do. But it took them tens, perhaps even hundreds of times before their subconscious was properly attuned to what they were doing. Does this matter in medicine? Well, it does, because if you're a textual kind of person, you meet a sick patient, you will tend to think in terms of, well, their pulse 120, your systolic's 80, your sats are 86. If you're a visual person, you'll just look at them at the end of the bed and go, bloody hell. If you're a kinetic kind of person, you'll just want to do stuff. You just want to get me a Venflon, get me some fluids. We want to get in there. And that matters. I've seen it in casualty, that you have somebody coming in, and there'll be a fast rhythm on the ECG, and the physicianly types are standing around the monitor going, oh, I don't know, is that SVT or I don't know, is that regular? Maybe it's AF, I don't know, I don't know. The anaesthetist behind them is going, shit, there's no pulse. It matters. We get trained, our minds subconsciously, to see things in a different way. And I would suggest it's about that subconscious part of our brain. And once we're trained, once we're practiced into an area, once we have a way of doing things, it's kind of difficult to get things out. There's no suggestion that in the vast majority of cases that this is a permanent thing. It is plastic. There are a few who have defined deficits. So, we recognize dyspraxia as a medical condition, and that's a deficit in your psychomotor capabilities. We recognize dyslexia, that's part of your letter recognition categories. And some people, a small percentage of people have defined deficits in those areas, but most people have a preference, which is either more or less difficult to change. Some lucky people actually can switch between those different modalities relatively easily, and they're very annoying. Okay, your responses. This is 3 questions is not enough to get a reliable response. I think we have to recognize that when we're answering questions, there is an element of us thinking what we would like to be rather than what other people see us as or what we are really at. But I think it's very interesting results. I know it's difficult to see, but I'll give you the main headline. And by the way, this is feedback. It's very important as an educator to give feedback. Okay? As a group, the people in the room, you are primarily visual and kinetic. Okay? That means plus points, you will recognize problems relatively easily, and you will want to do something about it. That's good. You're doctors. You have a very low score in terms of textual ability. That means you are rubbish administrators. Okay? So, just to echo what Sarah found, just advice, do not try anything without a project manager. Because if you do not have somebody who understands text on your team, you're going to fail. Okay? Lesson today, project managers, they're very important. Somebody to fill the forms out for you, because you're useless. You really are. Okay. Importantly, do I believe this? No. Human beings are very complicated. The idea that on the basis of a few questions you can divide people up into one of 3 categories reliably is rubbish. It's the same with introvert, extrovert, reflect, and the rest of it. They have some use, but they are not reliable pass-fail type tests. However, I think there's a load of stuff, there's a load of questionnaires. The questions you've got today should give you an insight. So if you have a trainee or even a colleague who's having problems, it may well be useful to have a chat with them, see what their preferred learning style is. And I've tried it with the trainees who come through, trying to help them. You know, if they are psychomotor kinetic in anesthesia, they're great. They're going to be fine at anesthesia. They're going to fail the college exams. They need to spend more time preparing for exam style. They'll get the job. If they're highly textual, they're going to pass the exams first time. You are going to worry about them being on call at night. If they're visual shape like me, they'll talk a great story. They'll explain anything to you. They'll probably be okay, but they're going to fail the exams again. And it's like, I could alternate. You ask me a question, any question in a textbook, I will be able to draw you a picture of the 2 pages of the textbook, and I'll be able to tell you where on that page the answer is. The chances are I won't know what the bloody answer is, but I know it's there, and it's just above that diagram. So is this reliable? No. Does it provide some very useful insights that we can help our trainees to get better? Yes. Thank you.